What brought me to Woodstock Hospital, I guess initially, was my mom had a massive stroke and was transferred from KW Hospital into back home here to Woodstock.
I was diagnosed with Crohn's when I was 19, so a lot of my stays are Crohn's related. It's usually a flare-up, so I come into emerge and end up in the hospital. Mostly it's been 3 weeks at a time.
She was first put into rehab, and that wasn't going to work. Her stroke and dementia kind of increased with, it just got worse. And so she was put on complex continuing care where she spent about, well, all told, she was in the hospital for 9 months.
Most of my stays here have been for the Crohn's, and through that I think they've gotten to know a bit more to help me when I come in what I need.
The patient's voice is critical to the care they receive at Woodstock Hospital. Processes and policies that are relevant and make sense from the patient perspective are very important to us. We want to hear opinions and experiences to make better informed decisions related to the way we provide care. We want our patients and their family members to help us design the care they receive at Woodstock Hospital. That's why we created the Patient and Family Advisory Council.
Our mandate really is to look at how we communicate information and support both patients and family within the hospital. And it's a really great adjunct because the folks around the table have been patients or have worked through the system with family members. So our role is to look at patient education, policies, procedures, new initiatives, and provide that perspective, that family and patient perspective.
I think the council really helps keep that check and balance system in place so that it is geared towards making sure that their patients are getting the best experience that they can.
We work in a very complex healthcare system, but what I hear is important to the patients and families that I talk to is based on the small moments and interactions they have with caregivers and support people. It's these small moments that leave a lasting impression for the patient about the healthcare they received at Woodstock Hospital. Did they listen to me? Did someone go that one step further for them, such as giving them a warm blanket or being gentle with them when they were transferred into a chair? The Council makes recommendations on matters that impact the patient and family experience, providing input on policies and participating in the planning processes, such as our visiting hours and access to services.
Having been a patient so often, I felt that if I could help people coming in the future to have their stay go maybe more smoothly, then it's worth it for me to just be able to voice what I've been through that will maybe help them look at something differently or streamline certain things that can help patients coming in the future.
We hope that by incorporating our patient and family opinions, we can give our patients compassionate, quality care that's really focused on the patient and family experience.
My engagement is because of the experience I had. I really want to make sure that everyone else gets the same great care that my mom received, and any areas to tweak improvement. I would love to be able to share that and let people know that this is we're in a very lucky community to have this hospital. And
knowing that you do have a voice and that they are taking you seriously and that you're not just frivolous, like they genuinely care about what you have to say and what your experiences have been and how they can change to make things better.